Welcome back. Growing up in a community that shaped her mission, our next guest has dedicated her career to reducing maternal morbidity and advancing health equity for underserved populations. Beyond medicine, she's also a founder of a lifestyle brand blending fitness, wellness, and health coaching to empower individuals in holistic ways. Joining us is the health and wellness expert and author, Dr. Eboni January.
Good morning.
Good morning, doctor. Thank you so much for sitting down with us today.
Thank you. Thank you for having me.
Of course, so let's dive right in. Tell me, what inspired you to pursue a career in obstetrics and gynecology, and how did your upbringing in East St. Louis influence your commitment to women's health advocacy?
Well, actually, my interest is twofold. It started initially with my grandmother. My grandmother had given birth to 14 individuals. So I became really, really fascinated by that initially. And also at the same time, when her health started deteriorating, I started seeing that there was much concern and many things that needed to happen in the community. And at the same time, when I saw her health to deteriorate, my stepmother became pregnant with my youngest sister, Alyssa. And so it was at that time where I saw a body who had given life deteriorate, and to also watch a body change. Um, it really, really fascinated me and affected me. And so I saw that I could do so much in women's health. Not only could I help with regards to primary care, I could also do surgery and I could also deliver babies. So that in and of itself was enough for me to say, at the age of 14, I'm actually going to go on to medical school. I'm going to be an OBGYN, and that's what I'm going to do. And that's what I decided to do.
That's such a beautiful phrase, a body that has given a life and a body that's changing. I love that. It's very full circle, circle of life. I really, really love that you phrased it that way. Now, I want to talk about your prestigious awards, the Lifetime Achievement Award from President Obama. How do these accolades shape your mission to reduce maternal morbidity and promote, health equity?
When I received the award, and it was completely unexpected. When you're focused on the mission, you're so focused and you're not really worried about whether you are getting trophies or awards for.
Mhm.
You do it because, in my mind, I do it because I'm supposed to do it. And so, what I started doing was, when I started practicing full time, I started seeing a lot of women in the underserved communities that were struggling with regards to their health and things that were so preventable. I grew up in a household where my dad juiced, right? And so these things were natural to me. Stevia, that's super popular now. My dad would put it in our tea in liquid form. He grew, vegetables and fruits and things in our backyards, even in East St. Louis, which is, completely out of the norm, where we live in food deserts where you don't have people that are growing food, or you don't have a big grocery store. And so it was quite natural to me. So when I saw it in my patients that they weren't eating right and there were preventable causes of death, that I could help prevent, then I started educating. And so that's what really drove me to get into the space of health equity and making sure that I'm advocating for patients, but also educating. And here I am.
Here you are. Again, congratulations on those awards. But like you mentioned, it's not something you necessarily set out to gain, right? But it's something that you do because you love it and you want to make change. And truly, the recognition is just, the cherry on top of it. But
Exactly.
yeah, so let's also talk about your lifestyle brand, Bossish. How do you
Mhm.
integrate health coaching, fitness, and wellness into your broader advocacy efforts?
Well, it's hard to do one without the other, right? Especially in my mind, right? So what I do as an OBGYN, I started seeing women who were very, very busy. They were everything to everyone and nothing to themselves. And so I said, let me give them the tips and tools that I utilize, the balance that I utilize in order to stay healthy, being a busy physician, being, sitting on boards, doing a lot of community outreach, being a family member. I take care of a sick dad. At the time, I had a sick grandmother, and also my mom being ill as well. So what I started doing was, I said, you know what, I'm going to give them essentially my brain, my regimen. And that's what Bossage was birthed after behind. And so I said, I'm going to show them that you can be both. You can be a boss, in your own right, but you can also be healthy. So I give them tips, tools that will allow them to be healthy even inside their homes. Quick recipes that they can do in the home, workouts that they can do the home, how to integrate it with your children. Because, like I said, with my dad, we didn't have soda in our home. We had juice, and so kids put in their body what you introduce into them. in front of them. And so I started teaching women quick tips and tricks that I utilize in order to stay healthy. And that's when I birthed Bossish.
I love that because a lot of times when we're so busy with work and for women who have families, it all gets in the way. And the first thing to
Mhm.
go essentially is your wellness and what you
Absolutely.
do for yourself. You're the first person, to go in a sense. So I really like that you bring that in. It's like, hey, listen, you don't have to make this massive change overnight, but
Yeah.
it's these small little habits here and there that are going to
Hmm.
add up.
Absolutely. So, one of the things that I posted on social media was a picture of me doing squats with my with a little baby,
I
right?
love
Not
that.
my baby, but it was my dad's caregivers. It was her grandson, and
Hmm.
so I was doing some squats, and I did some steps, some exercises up the steps with him, and just kind of showing women that you can integrate both, right? Even if you're in the kitchen cooking, you can do some body weighted exercises. You can do some push ups. You can do some that are assisted against the countertop. There's so many things that you can do that we don't think about right now. I have a desk lift.
Hmm.
And so that's something that I utilize in order to stay healthy. I have the under the desk treadmill. There are things that we don't necessarily think about. It's not as hard as you think, right? And like I stated, with regards to young people, we think that, oh, they're not going to eat this, but they're going to eat what you introduce to them. I always tell people, my game, my rules. And it's the same way inside of the home. Like, give them what you have, and in order for to create good habits for your children and your family.
Absolutely. Again, it doesn't have to be this daunting thing of like,
No.
oh man, I have to go spend 3 hours in the gym. It's simple things that you do in the middle of your daily task, which I think is really important.
Yeah, I tell people my jump rope and resistance bands have more sky miles than most people because I literally take them everywhere. TSA always flags me because it's a weighted jump rope, and it always gets dings, and I'm like, oh, it's my jump rope, and they're like, oh, you must do this all the time. I'm like, yeah, I do.
Absolutely, that's commitment. I love that. But you also emphasize the importance of health literacy. Now, before we talk
Mhm.
about the significance of can you just break that term down for our viewers who may be unsure of what that actually means?
Sure. Health literacy is just that, it's being literate with regards to your health.
Hmm.
Whatever, whether you have a coexisting condition or whether in general you just don't have anything, but you want to know more about your health. What is it when we're running labs? What does that mean? What labs are we running? Like, I may have a patient that may come in and I say to them, I'm going to draw labs and I'm going to check for this. And they say, well, the other doctor already, they checked me for everything. And then I'll go a little bit deeper to ask, did they check you for this? Did they check you for this? And they're like, I don't know. Well, health literacy is not just about understanding your health, but it's also about making sure that you have great conversations with your doctor, and that they answer your questions, and they tell you why they're doing certain things, so that you may be able to carry it on to the next person, so that you can also let your family know about it. So health literacy is being informed and also being able to be make informed and educated decisions as it pertains to your health. So that's been my biggest push, is education, education, to make sure that people know, and especially my patients and the community that I serve, that they know why we're doing certain things, and so that they can make informed and educated decisions, and they can advocate for their self in an informed manner.
Absolutely. And now let's talk about specifically for women. Why is health literacy so critical regardless of your income or your education level?
Well, as you can see, and we're talking about it quite often, is that we are in crisis. Black and brown women are dying at 3 to 4 times the rate as their counterparts. And so I think that it's important that, we know that many of this is systemic change that needs to happen, right? And systemic change takes some time. So
Mhm.
if the systems take time to change, we have to change how we respond to our health and how we deal with our health. We have to change from being reactive to proactive. Most people will say, oh, I changed my diet when I got this diagnosis. I changed my diet when I got this diagnosis. Well, now it's no longer an option to be reactive, because we see that women are dying secondary to preventable causes of death. And many times they sometimes what can help is just making sure that you're educated, where you can say, hey, I don't want this, or can you take a step back and tell me why we're doing this in the labor room, or in the operating room if you're going for a c-section. Is very, very important, especially in this day and age, because the morbidity and mortality is secondary to childbirth is getting worse. So we want to make sure that we improve it, and we can improve these things by making sure that you're advocating from an educated place. And that's why health literacy is so important for me.
Absolutely. And now, from a healthcare provider standpoint, how can they
Mhm.
improve communication to ensure that patients fully comprehend their health conditions and treatment options?
So, from a healthcare provider standpoint, it's time for us to make sure that we have educated conversations with our patients, that we talk to them like they're a family member.
Hmm.
Answer questions. It's no longer we need to be in and out of the rooms. You have to sit and take the time with patients, or even if you don't have the time, can we point them in the right direction of resources, right? And so I focus on that a lot in my book, Empower Motherhood, is making sure that you have the resources that you need to support yourself. If I can't communicate it in the way that you understand, maybe I can point you into in the direction of someone who understands. And so we have to. Everyone has to be accountable at this point. It's not just a us versus you. This is We're not adversaries, we are teammates. And so that means, as a doctor, I need to understand when my patient is just nodding their head like they understand something and they really don't, and I see that often. So I have to make sure that I read body language, that I offer the teach back method. And that means that if I'm teaching my patients something, I want them to repeat it back to me and explain it back to me in terms that they understand, so that I can know that they fully understand something. So as doctors, we have to make sure that we understand that it's time for us to educate. It's time for us to understand our own biases, because we can be even of the same um, complexion, we can be the same nationality, we can be the same culture, and we still not quite understand each other, right? And so it's important for us as doctors and healthcare providers to understand our own biases, and that there are sometimes language barriers, and we can speak the same language but not speak the same language when you're from different places. So we have to understand that we all play a role, that this is a team approach and it's not an adversarial relationship.
Absolutely. It is a team effort, as you mentioned. And I love your hands-on approach. I love the teach back method. I think that's so beneficial, especially in an age where, again, you're not really sure of what you're being told. And you're just like, sure, they're telling me this is it, and that's what it is. But
Oh, the head nod. They always do
Mhm.
the head nod. I'm like, do you truly understand?
I'm a little guilty of it too, I can't lie. But I do love that method. But I do want to jump into your book, Empowered Motherhood. It offers guidance for modern mothers navigating pregnancy, childbirth, and postpartum. Can you tell us what inspired you to write it, and what do you hope that your readers take away from it?
Well, what really inspired me were the patients, right?
Hmm.
Often I was seeing that head nod, and I knew that patients weren't really understanding things. Or, I would go into rooms, and I'll tell you, I'm licensed in 15 states, Florida being one of them, New York being one of them. But I remember being in Miami practicing, and I had to do an emergency C-section on someone who was bleeding. And she came
Hmm.
in, it was very quick, everything happened so fast. And I did a very quick history and physical, and I said to her, any complications with your pregnancy? And she spoke another language, but we had a translator, and her husband was there as well. And she said no. She said no, that there was nothing that was going on with the pregnancy. Everything was fine. I get in. I did emergency C-section on her because her vital signs were changing and she was bleeding, which she had something called placental abruption.
Hmm.
I go in, and when I pull the baby out, the baby had no brain. So here, up, there was nothing. That's called anencephaly. And so afterwards, the pediatrician is looking at me like, we didn't have to do this. And I had to tell the pediatrician, well, I have two patients, the mom and the baby. So we had to do this because mom's vital signs were changing, but, and she was bleeding excessively. However, the mom didn't understand that when the doctor saw her in the office, that this baby was incompatible with life. She thought that she could have a nice normal baby, that this was going to be, yeah, maybe a baby with a little bit of difficulty, but this was incompatible with life. So that was one of the turning points for me, that I said to myself, this can't go on. I have to educate these women. I need to let them know what it's like pre-pregnancy, what they should be worried about, and what they should work on before they even get pregnant. When they are pregnant, these are the signs. This is what this means. When we're talking and using these big words, this is what this means. This is what that means. These are the outcomes. These are the risks. And when you get into labor, these are the things we're looking for when we keep coming into your room, or we're looking at the baby's heart rate tracing. These are the things that are associated with poor outcomes. If you had a previous C-section and you want a vaginal delivery, these are your risk factors. This is your risk of having a successful delivery. So I was getting these questions that people, or not getting questions that people should have asked, and I said to myself, I'm seeing this going in a bad direction. Let me give them the tools that they need in order to be successful, and they don't feel as though we're just poking and prodding and they have no say. And that's really what inspired me to write the book.
Wow, thank you so much for sharing that and for writing the book, because again, it's an important resource for people who want to become mothers, expecting mothers, and I think it really is important because again, we go back to you're being hurled all these terms at you and you just give the head nod. It's like, yep, sure,
Yeah,
thanks, and you don't
absolutely.
know how to navigate.
You don't know how to navigate. And so, with my book, you're going to get resources. If you have mental health issues, or potentially you may be undiagnosed, you're going to have mental health issues. You may potentially have mental health issues postpartum. You're going to get resources for that. You're going to get links to websites. You're going to get websites for journaling. Some people, if they have a high risk pregnancy, they're in the hospital for a very long time. So, I'm giving resources for that. You're getting exercises. You're getting things broken down to you. What is a first degree tear? What is a second degree tear? What are the incisions for a C-section? You're going to get those things. You're going to get so many resources that you would have, that you need, that you wish you would have had. What I see a lot of times is women will say, "Well, I wish I had this book when I had my first baby, my second baby." But now, if you've had multiple babies, this book is for you. If you are a significant other, this book is for you. I break it down. There are pictures. It's color coded. It's easy enough for you to understand, and easy enough for you to be able to have a conversation with your doctor in an informed manner. You're going to definitely leave knowing something after you've read this book.
That's amazing. And for this book, you've done a book tour. Tell us some of
Yes.
the cities you visited, and you did mention just now, but tell us a little bit about what the feedback has been like.
Yes. So we just started 2 months ago. We started doing Black Maternal Health Week.
Mhm.
That was April 11th through the 17th. We started in DC, which was absolutely amazing. I've met so many people, so many advocates for maternal health. I met amazing doulas, and doulas are support. They're non-clinical, but they're support people, and they were the original birthing population of doulas. And so we're seeing a rebirth of doulas, and so I'm really excited about that. And I met so many in DC. I met so many people who were advocating from just a Congress standpoint. I've been able to connect with them. DC was absolutely amazing. We just left New York, which was phenomenal. Connected with amazing people like Jose Perez, who
Mhm.
he's been advocating since his significant other passed away 19 months ago. And so just some amazing people. A lot of support from men who now they're seeing that they can no longer be innocent bystanders in the exam room, and now you're having these individuals who are becoming single parents and men. And so now they want to know, they're involved. They're like, okay, what do I need to know? What do I need to look out for in the postpartum period? So it's been absolutely amazing connecting with people. People have been extremely supportive. And so I'm really, really happy. Our next tour stop is St. Louis, which obviously is my hometown. And then we're going to do Houston and Dallas. And we have a whole 20 city tour. So I'm really excited about it. But the response has been absolutely amazing. People are saying that they learned something. I've had, like I said, guys who are coming up saying, I didn't know that I needed to know this. I've learned so much. It's been absolutely phenomenal.
That's amazing, doctor. Again, I want to congratulate you on your book and just the achievements that you recognize. We are coming up on a minute, so just in a nutshell, can you tell us what advice do you have for individuals seeking holistic health improvements?
The fact of the matter is there's so many resources out there for you. Just know it's no longer time to be reactive. We have to be proactive as it pertains to our health. And if you have any questions, you can absolutely reach out to me. Dr. EJ at drej.com is my email address, and that's doctor spelled out. On Instagram, I'm Dr. Eboni January. That's doctor spelled out, Ebony with an I, and January just like the month. But DM me, let me know what topics you want to hear about. Also email me. I answer questions on a regular basis.
Great. Thank you so much again, doctor, for sitting down with us today.
Thank you.
We have to take a quick break. We'll be right back after this.